All right, my view, Joe Biden wants amnesty at any cost, including sacrificing public health in the process. Joining us now to talk about this whole Title 42 business, Steve Miller, former senior White House policy advisor and founder of America First Legal. Steve, welcome back to the show. I don't know if you saw it today, New York Post.
Thank you.
Bob Redfield and Mark Siegel, Dr. Redfield, who ran the CDC under Trump, and Mark Siegel, who's a Fox contributor, doctor. You know, they're writing, among other things, Title 42 is important for public health, and it still is. And therefore, that's a reason why we ought to keep it. And the Bidens are willing to let it go. The Republican governors, as I understand it, Steve, they want to keep Title 42 for any number of reasons. One is upholding the border, and second is public health. So what do you think about this part of it?
Well, I mean, it's pretty straightforward. Illegal immigration is a disaster for public health. It has been for a long time. That was, of course, exacerbated severely by the pandemic, as well as all the other diseases that come across the southern border. Everything from the flu to scabies to tuberculosis and many other diseases. So this is a public health crisis in addition to an illegal immigration crisis. No American should have to get sick, let alone severely ill, because human smugglers and traffickers are bringing people by the truckload across the border. It's one thing if you get sick or you get ill because of normal, existing, free living and free commerce in a free country. No one should get sick because of criminal behavior conducted by criminal organizations taking place illegally on our southern border. The Biden administration has been working for 2 years to eradicate Title 42, along with every other border control, because their objective is to get as many illegal immigrants into the country as possible, and then ultimately, of course, as you said, to give them amnesty.
Well, that's the thing. I mean, they, may not protest too much. They're always telling us about COVID. Well, what about other diseases? I mean, Redfield talks about this and Mark Siegel talks about this. You mentioned a few very important ones, by the way. We have no idea what these illegals have, what's on them. Why? I mean, I don't want them to be sick, but they are sick. They're stuck in these cages or very poor housing that diseases spread rapidly. And then, of course, there is the issue of fentanyl and the drug addiction. So the Bidens have no solution to this. They don't even discuss this part of it.
Well, our public health is the casualty in their quest for open borders and amnesty. What they're trying to do, and it's sad that you have people like Tom Tillis falling for it, although maybe I'm being too generous, maybe he just agrees with it and isn't falling for it at all. But in fact, I think that's probably the better explanation. But they're trying to extort the Senate and Congress into giving amnesty by making the pain so unbearable and so excruciating, and then pretending that, oh, well, if we pass this giant bill, we'll make it stop. Of course, they won't make it stop. What they'll end up doing is they'll end up saying, wow, this worked amazingly. We had an open border and we got amnesty. Let's keep doing this forever. The only way this ends, Larry, the only way it ends is if the House of Representatives passes an appropriations rider prohibiting the federal government from releasing any illegal aliens on the taxpayer dime.
Wow. That's important. That's one of many reasons why this omnibus bill's got to go down, and we've got to let the House budget people come in and Republicans in the House and change.
For the love
all
of God,
these
stop the Omni and let the new House do this, Larry.
Right.
What are we doing here? We have a new House coming in 10 days or so, and here we are passing a 5,000-page bill right before Christmas.
Well, I talk about it every night, including tonight. I'm doing the best I can. It is a problem, but this is just one. This is an important point, though. Look, I was on Tucker the other night. He asked me about this. I said, sure, they would redo all the priorities for the border that the Bidens won't do. But the thing is, Bidens want to get rid of Title 42, to come back to that. Not a word about the public health risk. They don't have a backup plan. In fact, they still maintain the border is closed. I mean, I ask you, how can they do that? They still maintain it. Their press secretary says it almost every day. Mayorkas, the DHS secretary, says it every day. Oh, it's not a problem. No public health problem, but there's no border problem.
It's the lie. It's the lie of all lies. I mean, I can't remember any time the government has told a lie as monumental as pretending the border is closed or secure when it is completely wide open, as testified to by the millions of illegal immigrants wandering around Chicago and New York City and San Antonio and everywhere else in this country where they are free and at large and living their lives undisturbed by the federal government because Biden let them in. And, you know, at the end of the day, you want to understand what this administration cares about. They're willing to punish your kids, punish your businesses, destroy your lives over COVID. The one thing they will not do is stop an illegal immigrant from breaking the law. That is the one thing they will not do in the name of disease management.
You know, I still think, all right, I say it, it's an opinion, but I'll say it again. I think the Bidens, at any cost, will promote amnesty. All right, I don't care. People may disagree with me completely, but that's my view.
You're right, and there's no longer any counter argument. We have 2 years of evidence. There's 2 years of evidence. It can no longer be disputed that everything that's happened is deliberate, willful, intentional, premeditated.
Yeah, it's the strangest thing I've ever seen. Anyway, Steve Miller, thanks for weighing in. We appreciate it.